how come when a squat looks like this, it then looks like this when you go on a slant board? Let's break it down. So there are two main reasons as to why a horizontal squat shifts to a vertical squat in a heels elevated position. It comes down to the center of mass and a locked door. Now in a moment, we are going to demonstrate on the slant board so you can really see it. But what I want you to do as we're comprehending this first is to stand up. I'm going to give you two drills that you can do so that way you can feel it. The more you feel it, the better you can coach it. So I encourage you to stand up now. Let's go through the first one. Center of mass. If you have a slant board, grab it. If you can elevate your feet on books or anything else that you have in your house, grab that now. If you go in a heels elevated position and try to not fight back, let your body be really loose, and then see what happens. Are you naturally getting pushed forwards, or are you naturally getting pushed backwards? If you genuinely do this in a relaxed position, you should feel and or fall forward. Now, if we go back up and we do this and let our body respond normally without falling, what happens? We stand up there, we don't fall. What's going on biomechanically? Well, if we're shifting and getting pushed forwards, the pelvis is going to have to respond with a slight posterior pelvic tilt. This slight shift in center of mass posteriorly helps us from falling forwards. Now, that's half the battle to really letting us go through a vertical looking squat. The second part is a locked door. So if you're watching this on your phone or your laptop, go ahead, pick it up and go in front of a door that has the ability to lock and unlock. What I want you to do is to first keep the door unlocked. Now, go down, squat to touch that door, and once you touch it, keep squatting. When the door is unlocked, what happens? You should feel that you're pushing back more horizontally, and you're not going in that more vertical trajectory. Why? Because the door is unlocked. You're allowed to push through it, and you're going to continue to push on through it. Now, go ahead and lock the door. Same drill. Squat to touch the door, keep pushing into that door. Now that it's locked, what happens? You don't stop, but you should feel you slide down. So when the door is unlocked, we move horizontal. When the door is locked, you move vertical. When we have a center of mass that's more posteriorly oriented, it creates sacral counternutation and external rotation. So if I turn this around, counternutation is a posterior tilt of the sacrum, and external rotation is when we get compression back here. This is your locked door. When we can achieve a position that is like this, it's going to create a vertical squat. If we have a position that's more here, it's going to create a horizontal squat. So when we couple the appropriate amount of center mass shift posteriorly to have an effect at the pelvis to then lock the posterior pelvis, aka concentric muscle activity of the glutes and external rotators, this is why we will start to see a vertical squat on the slant board. Now, let's go into the slant board so you can see what I just did in case you weren't following along. To feel the center of mass, step on a slant board with your heels elevated and let yourself be really relaxed. What's naturally happening is your feet and your pelvis, things are readjusting so you don't fall forward. When we go to a heels elevated position, there's a natural inclination for us to fall forward. Now, anteriorly tip the pelvis as much as you can and be really loose weight. And we start to fall forward, right? We have shifted the pelvis anteriorly, our center of mass goes forward. Now, posteriorly orient the pelvis here, there. This is what happens when we throw our patients into a heels elevated position. It naturally biases a posterior pelvic tilt. What this is going to do is lock concentrically back here and open eccentrically back here. What does that do from a squat? That allows us to go very vertical. How? Think of the locked door analogy. If there was a door right back here and it was locked, how would I squat down? I wouldn't be able to push this way because the door would stop me. So the posterior pelvis acts as that locked door. It allows that patient to maintain that slight posterior bias, sliding down the door. Really imagine a door back here, sliding down the door, which keeps us very vertical. This is why we start to see a totally different shift in the trajectory from our person that was here to now the person that is here.